I'm Dr. Chris Chittum. I'm a neurosurgeon here at Carolina Orthopaedic and Neurosurgical Associates. I did my neurosurgical training down in Charleston, South Carolina at the Medical University of South Carolina. I've been here in practice in Spartanburg since 2006, continuously. I'm currently the president of Carolina Orthopaedic and Neurosurgical Associates. The types of surgeries that I perform are both in the brain and the spinal cord. In the brain, we have brain tumors, we have hemorrhages, we have trauma. Someone is in a car accident, they fall off a ladder, those types of things. We deal with those on a daily basis. In terms of spinal surgery, much more often these are elective. People have bad back or neck pain, their arm is going numb, or their hand is getting weak and they're dropping things, having problems walking any distances. So we evaluate those and perform certain surgeries that will treat these conditions. Many times, the most common thing that we do is neck surgery. People have a disc herniation or arthritis that's pushing on a nerve. We'll go through the front of the neck and do a small incision, take the disc out, and fuse that section together. People recover from this very quickly, have minimal amount of pain. Many times it's outpatient surgery. They go home the same day. Some of the back surgeries that we perform are for disc herniations or degenerative disc disease, in which we treat the area that's causing the pain.